APP stands for Advocacy and Public Policy, and it is a project which PATH has been implementing since 2017 in Uganda. APP focuses on strengthening the policy framework, increasing investment, domestic investment in health, and strengthening the capacity of civil society organizations to advance the health advocacy agenda.
PATH has supported us in strengthening our capacity as an advocacy organization through our human resources, whom they've trained in advocacy, and it's through that training and support that we developed our first ever advocacy strategy for the organization. And that has actually attracted a big funding for us. I think it's through that PATH assessment that, and capacity building and support that we are pre-qualified by the US mission here in Uganda. And we've been able to be trusted now with we have programs up to $1 million that they are supporting, but that's from the systems that PATH has supported us develop and put in place.
So APP focuses on primary health care, immunization, medical oxygen, and reproductive, maternal, newborn, child and adolescent health.
We've worked with PATH in the PHC think tank with other organizations, and through that effort we brought to light the importance of how and the need for government to invest in primary health care and specifically in community health workers. Through the engagements, the Minister of Health, the Health Committee of Parliament, we have seen government come out to commit resources for investing in community health workers, equipment, supervision, but also compensation. And this has been highlighted and committed in the budget framework paper for the subsequent years.
PATH has been a great sounding board in terms of how do we engage other civil society entities, how do we engage with government entities, but more so the biggest benefit we've had is to be able to have a forum through which that we can engage with hundreds of civil society organizations that have a footprint across the country.
PATH has played a coordination role. Where at some point they were chairing the reproductive maternal neonatal platform. And that time they picked the platform where it did not have strong governance structures, actually was forming. And by the time PATH handed over to the current chairmanship, the RAMNA platform had strengthened its governance. That's why we meet on a quarterly basis. We are able to convene all the CSOs. The membership has grown. We now have over 180 organizations as members of the RAMNA Plus N platform. And one of the key roles of the platform is actually accountability holding under what we call the RAMNA sharpened plan or the investment case.
Fortunately, as Uganda Healthcare Federation, we're an umbrella for the private health sector, so it's a natural partnership between us and PATH to see how do we work together. So even in our discussions, a core component is sustainability and ensuring that we can take ownership of these interventions as an organization. So through PATH, we've been able to hear more about the Gavi agenda, the Global Fund agenda. How do we pick that up? How do we invest ourselves and position ourselves better to benefit from these arrangements? So their role as a coordinator, as a convener, and as an engagement partner has enabled us to take our activities to the next level.
PATH engages government at several levels. First and foremost, through providing data that allows for example, members of parliament who sit on the health committee but also on the immunization forum to be able to advocate for increased financing. So what we do as PATH, we connect the two. We connect the Ministry of Health and the Parliament of Uganda, particularly by providing them with data that now allows them to advocate in the right way.
80% of the current members of Parliament are new, and therefore there is need for capacity building, which has basically been done by PATH. And also it has helped us to move motions on the floor of Parliament to see to it that we increase funding for immunization.
We also work on the policies, helping the right policies to be set up, to be formulated, to be updated, and to also be implemented. And that we mainly work with the technical teams at the Ministry of Health.
The scale-up implementation plan for medical oxygen, is a 5-year roadmap developed by the Ministry of Health to increase access to medical oxygen. PATH actually participated technically in this plan. The biggest contribution was to our resource mobilization objective, where they supported us with input in the monitoring and evaluation. So as a team, as the ministry, we're actually grateful for the technical input of the PATH team.
We don't take the involvement of CSOs like PATH and other development partners for granted. They keep on nudging us, they keep on speaking to our conscience that, guys, this is a priority area. So personally, as a chairperson of the Committee on Health, I give a lot of time to CSOs because, one, they focus on a particular niche, go down it, do research, they have the facts, and by the time they come to interface with the Parliamentary Committee on Health, they are very well grounded.
Previously, we would do advocacy as a general approach, but now we are more specific and identifying key issues to advocate for, looking at which targets to work with, and this has helped us in our performance management, understanding that we need to invest and plan and invest in key advocacy issues, track our progress, and be able to achieve those more effectively than we used to do before. So this has been beneficial because PATH helped us streamline how we do advocacy, and we're on a different trajectory altogether.